Okay, here we are on the dental day where we are analyzing the teeth and we are doing the dental charting worksheet. For this activity, you need this piece of paper. You only need one between the two of you. You need these teeth. You need one of these pen or pencils. It's in the drawers. You're gonna also want an actual pen or a marker. And then last but not least, on your computer screen, there's this thing called the Dental Charting Legend. And this is actually one of the most complex. I thought that Pax Patterson did a crappy job explaining it to you. So here's how it works. To start off, all dentists, as a universal sign, they label teeth starting with the number one. That's why I wrote number one right here on the patient's top back right tooth. So if the patient was facing this way, this is their right hand side. And the numbers go 1, 2, 3, 4, 5, 6, 7, 8, 9, and then they keep going. And so right here, yeah, these teeth are missing. It's a bummer, but whatever. Tooth number 9, there's a problem with it. You can see how it's kind of like broken off. And on this dental chart, it says it's a fractured tooth. So this matches that. Now what you're going to be doing is you're going to be labeling problems on this sheet. So I'm going to help you with the very first one. It's got fractured tooth, and then see right here where it says number 9, because this is tooth 1, 2, 3, 4, 5, 6, 7, 8, 9. A dentist will put a red line on that piece of paper to indicate that that's where it's fractured, and then they will write right here in tooth number 9, they'll write fractured tooth. I'm going to do the next one. The next one actually is missing. It was erosion. So what I'm going to do is I'm just going to write erosion here, and I'm going to cross out fractured and erosion because you're looking for these things. Now for teeth 11, 13, 14, 15, and 16, there is something wrong with them. And so when we get to it, so here's 9, 10, here's 11. What's wrong with that? That looks funky. 12 says it's okay, but 13, 14, 15, and 16, there's definitely a problem. Then what you're going to do to figure out what's wrong with 13, 14, 15, and 16 is you're going to use the dental charting legend right here. I'm going to give you a hint right now. The last one, see how it sticks out? It's higher than all of the other ones. On the dental charting legend, that's what's called a super eruption. You can see how it's drawn right here, how it comes up above. And to mark that on the chart, see how we take the red pencil and we just say, boop, it's pointing up. So I know that number 16, which is right here, needs an arrow going like this because it's a super eruption. And then look, super eruption is one of these vocabulary words right here. Here it is, super eruption. I'm going to cross it out here, and I'm going to write it down for number 16. So what you're going to have to do is look through the dental charting legend, figure out what's wrong with 11, 13, 14, and 15. And I'll give you a hint. It's one of these 4 choices. Mark it with the red pen, and then write that down. Now on the bottom, you've got a couple of different things. I'm going to give you some more answers because I think that it's kind of dumb. Going back to the numbering of the teeth, we go 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, and then dentists count right here, they go down to 17. Now 17, see how this tooth is like all gnarly in here? It's been impacted within the gums. And so once again, 17 impacted, we just take our red, we circle that, bad news bears, then we go here to impacted, and we get rid of that. Right here, so 17, and then this will be 18, and this will be 19. Number 19, this is what a root canal looks like. See how this right here is just the top of a tooth, and there's this little black thing in here that indicates where they've drilled out and they've replaced it. It's not actually blood. So for 19, you get to write root canal because that's what it looks like. And On the legend, what we're going to do is we're going to look up root canal. So I'm cruising through here. I'm right here, root canal and crown. What we do to do that is we just mark the red where they've changed it. So I'm just going to go ba-da-bup, 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 ba-da-bup. So I've got the root canal right there. I don't need you to do number 20. So we're going to cross out number 20. But I do want you to figure out what's wrong with this tooth and this tooth. So out of these choices, what could be weird about these ones? The rest of them are fine or they've broken off. So which number teeth are these and what's wrong with them? So just do these ones. So you got to figure out these ones. And then again, 11, 13, 14, 15, mark it on the charts and then show it to me. Good luck.